Thank you, and good afternoon, and welcome to today's webinar. My name is Tasha Green-Cruzat, Executive Director for Voices for Illinois Children. I want to thank all of you for joining today's webinar. We have a full house today and a very packed agenda, and so we're going to go ahead and get started. I want to start by introducing all of our panelists today. Starting with Dr. Bill Burns, who is the Kids Count Manager for Voices for Illinois Children. He will provide an overview of the state employment and labor statistics. Next, Deb Stein from the Partnership for America's Children in Washington, D.C. will go over the latest federal relief package, followed up by David Cooper, Senior Analyst, Economic Policy Institute, and Deputy Director of the Economic Analysis and Research Network in Washington, D.C. He will review unemployment rates and the national economic picture. Next, we will have David Merriman, Stuckel Presidential Professor, Department of Public Administration, Senior Scholar, University of Illinois at Chicago, and the Institute of Government and Public Affairs at the University of Illinois. He will tell us what is ahead for Illinois. He will provide the state economic picture and the state revenues. And then last but not least, we will have Mitch Lipson, who is the Vice President of Policy here at Voices for Illinois Children. Next slide, please. Before we get into this presentation, I just want to provide to you a quick update. So as of yesterday, 2,538 people have confirmed positive in Illinois. We've had 26 unfortunate deaths, and we have tested a total of 16,631. Illinois is preparing for a surge in hospital admissions, and so there is discussions of possibly having McCormick Place as a hospital to treat this terrible pandemic. Next slide, please. On March 20th, Governor Pritzker issued a stay-at-home order for all non-essential workers through April 7th. This is also extended until April 7th, a prior order to close all K-12 schools in Illinois. And as part of that order, Governor Pritzker has also mandated that all child care centers licensed by the Department of Children and Family Services, as well as legally licensed exempt centers outside of schools. All child care homes licensed by DCFS, early education programs in public and private schools are also required to remain closed, while K-12 schools are all closed. So effective March 21st, 2020, child care centers that wish to serve as emergency child care sites for the children of critical emergency workers may apply for an emergency care license. Bill, I'm going to go ahead and kick it off to you to get us started with the presentation. Thank you.
All right, thanks so much, Tasha. Hi, everybody. Thanks so much for being here with us today. I'm Bill Burns, the Kids Count Project Manager at Voices for Illinois Children. I'm going to keep things relatively brief today because we've got a lot to cover, but I want to give a quick overview of the groups that are probably going to be the most impacted by what is likely going to be a prolonged period of recession in Illinois. So first of all, the American Community Survey notes that over a third of Illinoisans over the age of 16 who are work in industries that are being hit very hard by the pandemic. And that includes retail trade, healthcare and social services, arts, entertainment and recreation, and accommodation and food services. And this totals to about 2.085 million people throughout the state. Next slide. This is a map showing by census tract where people who are working in these four industries tend to be located and concentrated. The areas with higher concentrations of people in these industries are going to be hit particularly hard by the state locking down public places and bars and restaurants and so on and so forth. Next slide. Now, when unemployment hits, especially in a recession, this impacts groups of people in very different ways. We can see here how unemployment hits younger people particularly hard. Unemployment rates for people aged 16 to 24 didn't start seeing decreases until 2011, which was a little later than most other age groups. Next slide. But this is particularly pronounced if you look at unemployment by race and ethnicity. So for Black Illinoisans after the Great Recession, unemployment didn't start decreasing until about 2013, well after it had started decreasing for other groups as early as 2010. The yellow line is for those who are American Indian or Alaska Native, and I think the wide variation you see year by year for that group is because the numbers have higher margins of error than other groups in this chart. Next slide. And for those who are living below the poverty line, unemployment hits particularly hard. And in 2010, it peaked at a rate of just over 35%. Next slide. What we are currently seeing is an unprecedented increase in the number of unemployed people, both in Illinois and nationwide. In the chart here on the left, we see that the blue columns represent the actual number of unemployment insurance claimants by state, with the orange columns showing the number of people for whom the state is liable for paying unemployment compensation. In 1 week, the advance claims jumped by almost 104,000. And on a national level on the chart to the right, the number of jobless claims has skyrocketed to points not seen before. Next slide. So people who can't work aren't able to make money, which is going to significantly affect people's ability to stay above the poverty line. And we know that poverty works very differently across lines of race and ethnicity. Poverty most significantly affects Black Illinoisans, as well as American Indians and Alaskan Natives, multiracial people, Latinx people of any race, and those the Census Bureau identifies as other. Next slide. And poverty is not evenly distributed by geography. This map shows poverty hotspots throughout the states, and areas of urban clustering tend to see higher rates of poverty. Next slide. And areas of concentrated poverty are also of significant concern because these are areas not just segregated by class, but also by race and ethnicity. And for anybody who's interested in seeing these maps in an interactive forum, I can certainly share links to these maps after the presentation, and you can go on and check them out yourself. You can zoom into specific areas of the state if you'd like. So we can see here that what is likely to happen to different groups by race and ethnicity across the state, especially in the context of an unprecedented pandemic-driven recession. So Deb, I'll toss it back to you at this time.
Great, thank you so much. What did I miss a slide for you, Bill?
No, you know what? These are actually the links, but I will, since folks can't really interact with the presentation, I'll send these out to everybody who wants a copy of it later on.
Great, okay.
Thanks.
So I'm with the Partnership for America's Children, and I'm going to talk to you about the federal bill. Let me start by telling you that the House just passed the federal bill. It is not 100% clear to me whether they will now do a roll call vote. But one way or another, it will be done within the next hour if it's not absolutely final now. It's going to be sent to the president. He is expected to sign it. A couple of prelude things. First, please be patient if we have technical glitches. Zoom is pretty overwhelmed because everybody's using it because it's such a great tool. And usually I do this with a colleague, so she manages the slides while I manage the chat. And she has to be on another call because we're also crazy. The second thing I want to ask you to be patient with is I'm going to be giving you a big overarching picture of this bill. I can't touch on everything in it because it is hundreds and hundreds of pages. And I cannot give you details about implementation because it's not law yet. And so the federal agencies have not issued any guidance on implementation. What I can tell you is that as I get these resources, I'll be sharing them with Tasha and Mitch and Bill, and they'll be able to share them with you. So, you know, this is not the last thing you'll be hearing from the folks at Voices or me, but I'm trying to give you what we know right now. So the partnership itself is a network of 52 member organizations in 41 states, and Voices is our member in Illinois. and they all advocate for better policies for kids and families at the state and local level. I'm going to take you quickly through the federal policy responses to the epidemic. Now, none of this is about the administrative stuff about who sends medical resources where, or fostering a vaccine. This is all about what Congress and the president are doing. The first bill was actually passed just March 6th, which I think is just 3 weeks ago, which shows you how fast we're moving. And that had $8.3 billion in emergency response money. And that was essentially for internal government stuff for HHS, for the Centers for Disease Control, for the National Institute for Allergies and Infectious Diseases, things like development of vaccines and therapies, and there was also some international support money. The second bill was passed March 18th, which is a week ago Wednesday. And the cost on that is not really easily calculable because a lot of the provisions in it depend on the length of the emergency. It had some paid leave provisions. They're extremely important, but they have some major gaps in there. It does have 2 weeks for paid sick leave or paid quarantine at full pay. So if an employer provides paid sick leave, and I think they're required to, they get fully reimbursed by the federal government for those costs. The way they get reimbursed is by not having to pay payroll tax. And if the costs they're spending on leave are more than the payroll tax, they get that back as a refund. So the full cost of all these leave provisions are borne by the federal government and not by the business. It also has 2 weeks of paid family leave at full pay, and then it's got 3 months for paid sick and family leave at 2/3, but the family leave is basically just when a child lacks care. It doesn't cover, if I recall correctly, sick family members. It's got big holes. It covers organizations with less than 500 people. The government can give waivers for people with employees less than 50. It is only for coronavirus sick leave, not for other kinds of sick leave. It does cover nonprofits, but it doesn't cover organizations which can't do their work anymore because they're closed. So it's got a lot of gaps, and we're hoping that people can go back and take another crack at fixing that. It did provide for free testing for everybody, but not for free health care. It put a lot of money into state unemployment assistance systems for administering them and improving the administration to cope with this. I'll talk about the changes for benefits for the third bill. It put a lot more federal Medicaid money in, which is going to be critical because the states are going to have to spend so much more money on Medicaid, and it's going to gut your budgets without this. So the feds always reimburse at least 50% of your Medicaid expenses, often more. I think in Illinois it's only 50. It depends on the state. Now you'll be getting 56.2% reimbursement from the feds, which should make your state money available for Medicaid. It will help close a budget gap. And in return, they're not allowed to, they have to maintain their state money into Medicaid. They don't, unfortunately, have to retain their state money going into the CHIP program if it's a separate program. And I don't know if the Illinois CHIP program is a Medicaid one or a separate one. But if it's a Medicaid one, they'll have to maintain all the money going into that too. And then it had a whole bunch of provisions around emergency of food assistance. It had some money going into SNAP, but not an actual increase in benefits. It had some more money for WIC. Basically trying to make sure, among other things, that schools could feed kids when they were out of school. So that was the second bill, and that was March 18th. And here we are on March 26th, so 8 days later, and they're passing a bill that is estimated to be about $2.2 trillion. It is it's about 10% of the national GDP, I believe. It has a lot of provisions in it, and I'm going to walk you through them in groups. That's the bill the House just passed, and the president is expected to sign at any time. So the first set of provisions I'm going to cover are the ones that put more money into your state budget. It has $150 billion, and that's with a B, dollars, for states and local governments to meet virus-related costs in 2020. And the Illinois share is estimated to be just under $5 billion. It has another $45 billion for the Disaster Relief Fund. It has $30 billion for elementary and secondary schools and higher ed for things like distance learning costs related to the coronavirus. It has money for mass transit, for the community development block grants. It has $3.5 billion for CCDBG, the Child Care Fund, which we think is grossly inadequate. Child care advocates were seeking $50 billion, $50 billion, and we only got $3.5 billion. So that's going to be a big ask for the next bill. It has $400 million to prepare for elections so that the November elections can be conducted safely, even if we still have an epidemic. And it has $8 billion for child nutrition funding so schools can keep feeding kids when they're not in session. This amount of money is more than the federal government spent last year on grants to state and local governments. It is just the state and local budget piece of this bill is that big. It's really kind of mind-boggling for those of us who fight for $1 million or a few billion or $1 billion at the federal level. So then it also has really important, significant amounts of money to support individuals, and it falls in different pots. The first one is a one-time payment for everybody who filed income tax in what should say their 2019 or 2018. I apologize for the typo. So if you filed in 2019, they will use your income from 2019 to pay it. If not, they'll use your 2018. Everybody in the household whose return it is has to have a social security number. So immigrants who file with ITINs cannot get this. Even if one person has a social security number, they both have to, or they won't get it. It is capped at an income level of $75,000 for one person or $150,000 for married. And people over that get a reduced amount till it phases out. For a household that's getting the full amount, it is $1,200 per adult. So a married couple is $2,400, and then an additional $500 per child. And I believe the child has to be 16 and under. It might be 17 and under, but certainly 18-year-olds do not count. The child money you'll get no matter what your income is. Now, there are a lot of people who are not going to be able to get this. One group of people is people who haven't filed because they didn't need to pay taxes. They can still file and get it. And I'm flagging this for you because a lot of them may need help filing for taxes to get this payment. And if they didn't file their taxes in 2018 or 2019, they may need somebody walking them through this. We've got concerns that the industry that helps people file for their taxes, which can be very predatory and charge them a lot to get their money, may get involved. So you probably want to be looking to prevent that from happening and make sure people get the help they need without paying providers a lot of money. And people who get these payments, who get means-tested programs like Medicaid or SNAP, it won't count against your Medicaid or SNAP or any of those programs. Then they created 3 new uninsurance programs. And I'm going to say right here, these are going to be administered by the Small Business Administration. They do not have anything up yet about this. That's because it's not law yet. I expect them to try and move really fast to do it. I encourage all of you, if you want to apply for these, I'm sorry, I'm speaking incorrectly. This is going to be managed by your state insurance program. It is not ready to be, implemented yet. You have a big problem here because you're going to have to get your state possibly to change some state laws before they can implement it. And that's going to depend on Illinois state law, which I don't know. But Mitch and I have talked about trying to figure out what your legislature has to do to make this work. But here's the 3 provisions that this current law has that your state can do, but may have to pass legislation to do. The first is the Pandemic Emergency Unemployment Compensation, which is PEUC. This is basically something they do in lots of emergencies. They add 13 weeks of state unemployment insurance benefits for everybody who's already getting unemployment insurance or who's covered by the program. The second one is Pandemic Unemployment Assistance, PUA, which expands who can get unemployment insurance dramatically. And the groups that it covers are the self-employed, the hourly, and the gig workers, among others. Unfortunately, as far as I can tell, it doesn't expand it for immigrants. This is actually retroactive. I forget if it's retroactive to January or February. It goes through the end of the year, and whatever your benefits would have been under your state law, if you were eligible under usual state law, they'll be calculated the same way in this one. And then there's a third program called the Pandemic Unemployment Compensation Program. Everybody who's already getting it, and usually unemployment insurance is 50% of your wages with a cap. Everybody who's getting it will get your usual amount plus an additional $600 a week until the end of July. So from the time this bill is passed until the end of July, people who are getting unemployment compensation will also be getting this additional bump up of $2,400 a month. A couple of other things I want to flag for you about that. The states can modify your job search requirements. This is obviously a terrible time to do a job search. First of all, because the economy doesn't have, well, there are some industries which are hiring lots of people, right? Like Amazon. And then most industries have laid everybody off. So it's a really weird and difficult time to do job search. Your state should be modifying the job search requirements that usually come with UI to recognize that. And of course, the second thing is that you should not have to put yourself at risk of getting coronavirus to conduct the job search or to take a job. And so your state has a lot of flexibility on how to modify that. I think that would be within the governor and his administration's capacity, and that's something you guys might be wanting to look at. If you get that unemployment insurance bump, that $2,400, that doesn't count as income from Medicaid or CHIP, and it won't kick you off them. It has some loan relief. Your loans are suspended and you don't pay interest on them until September 30th. I think you may have to get in touch with your lender to make that happen. You may have to ask for it. There is some money for nutrition, but unfortunately they didn't put in the increase in the amount of benefits for SNAP that everybody wanted, well, that lots of people wanted. So the third thing, I've already talked about the money for governments, I've talked about the money for individuals. Let's talk about the money for businesses, nonprofits and for-profits. It puts $150 billion in a kind of Marshall Plan into the healthcare system. It has $500 billion for industry bailouts, with what they're calling side rails. There are limits on what industries that get this money can do. So they can't do stock buyouts for a year after they've paid back the loan. I think it's all loan money. They have to maintain their payrolls. I have not looked in depth at what the limits are, but there are some constraints on companies that take that money. Almost 60 billion of it is dedicated specifically to the airline industry. And I think that states and cities may be able to tap into this law fund for loans also. Then it has separate provisions for small and medium-sized businesses. This is where it'll be administered by the Small Business Administration. They haven't put anything up yet about the processes. I understand that it's all going to be part of their 7A loan process, emergency money. And I am told that it's going to be done on a first come, first served basis. So if you want to tap into this, you should apply quickly, but I don't think you can apply yet because it's not law and they don't have the systems up. So I will be sending Mitch and Tasha and Bill all the information about that as I get it. But you might also want to watch the website for your local Small Business Administration offices. What that includes is $350 billion in guaranteed loans to shuttered businesses to keep paying their employees. It works for for-profits and for nonprofits. And a lot of it, maybe even all of it, can be forgiven, turn into a grant if you have spent the money on a certain number of things, particularly including employees, and you haven't fired your employees. They're still getting their payroll. So if you have to close your doors, right, because you're doing some kind of business that doesn't let you stay in business during an epidemic, but you keep paying your employees and you take this loan and you use the loan to pay your employees, it becomes a grant. I do not know how you apply for it. Nobody knows. We'll keep you informed. There's a fund for disaster loans. There's another fund for $10 billion in direct grants for businesses that don't qualify for a different emergency loan program. And then there is a $17 billion amount to have the Small Business Administration make payments for 6 months of principal and interest payments for all SBA-backed business loans. I am sure there'll be a lot more information about this. It's, everything's just moving really fast. What else is in this bill that they just passed today? Your state has another year to implement the Real ID requirement. So it'll be next, a year from this fall instead of this fall. At the very last minute, they realized they had forgotten to put in anything about veterans health care. And by last minute, I mean 2 hours before the Senate passed the bill. That's how fast this was moving. So they put in another $20 billion for veterans health provisions. There are protections, temporary protections against foreclosures and evictions. There are provisions to stop Trump or other leaders having their business benefit from all of these business provisions, and there is no border wall money in it. So that's the bill that is going to the president. Now, they're already talking about a fourth bill. At least the Democrats are. Right now, the Republicans are saying, well, let's wait and see how this works. But I think there's a broad recognition that they probably will need to do one. It will be a different process because Congress is now on recess in their home states until April 17th or later, probably May. But what we're hearing is they'll be working remotely. It's not going to be the kind of recess where they're just meeting with constituents and not trying to build bills and do legislation. They just will work from home because it's safer, which we all do, right now, or anybody who has that luxury does. Here's a list of the things that advocates want to get included in that fourth bill. A 15% increase in SNAP benefits. I have not heard a lot of conversation about healthcare for the unemployed, but that is clearly going to be a big problem, and I'm hoping advocates will raise it. There clearly is a big interest on improving both the amount of money that will go into the Child Care and Development Fund, but there's also a lot of issues that affect other parts of the child care industry, like family daycare, like for-profit providers. Some of the for-profit and nonprofit providers for childcare should be using that business loan provision, and some of the family and sick paid leave, that stuff for employees that qualify for it. But even so, we think there are going to be dramatic increase in costs for childcare, and people want to get more funds for that. I had thought that getting grants for nonprofits would be high up there because our nonprofit community is struggling enormously. A lot of them have had to shut down fundraising events that were significant portions of their income. They have increased demands on them for funds in many cases, or they provide services that are paid for only when they're delivered, right? And they can't deliver those services if they increase epidemic exposure. So a lot of nonprofits are not getting the fee-for-service money that they usually get. And so we know that the nonprofit community is struggling a lot. I had thought, as I said, that we would need to go back and get grants. I think a question about that depends on how much the small business loans that convert to grants actually are tapped into by the nonprofit community. People clearly have a very high priority on getting better paid leave provisions for both sick leave and family leave. where they're very concerned about provisions to protect the homeless and the disabled. They were trying to get changes to the earned income tax credit and child tax credit to benefit people at the very lowest end of the scale. That did not happen. People want to go back for that. And I just wanted to give you a sense, first, of the provisions that advocates want to raise specifically on childcare. You can see it's a pretty broad list. Training and medical support, ongoing operating costs. If they're closed, they need to keep paying their rent and whatever. Eliminating co-payments or tuition for families while making sure that providers are still paid the full amount for every enrolled slot. Your state can, and I don't know if it has, start paying providers based on enrollment and not attendance, and I would hope they've done that, but you want to make sure that they get the full payment for enrollment, but families aren't paying co-pays when they have no income coming in. Paying substitute educators when their primary ones can't be there, hazard pay because people are taking a lot of risks, and materials for people that can't get supplies. All of these are on the table in the sense that the childcare community knows they need to try and get them. And Pelosi has already listed the things she wants, which is not an exact match for what advocates are asking for, although I think advocates would support all of these. But she's interested in the SNAP increase, more money for states and local governments because she doesn't think the amount in that bill was enough. Free treatment for coronavirus. Right now we just have free testing, but obviously people are not going to get the tests they need if they're terrified of then having to pay for expensive treatment. So that protects all of us. Bigger stimulus payments. She doesn't think the amount of payments that we're paying out are going to be enough. Expansions to cover all those gaps in family and sick leave that I talked about. OSHA protections for healthcare workers. The original effort to provide that for healthcare workers was removed because the hospitals said they couldn't provide them. And in fact, we don't have the protective gear. Their supply chain doesn't have it. So it got stripped out. People want to get it in there. I'm sure you've all seen the horror stories about doctors and nurses and other medical people having to work with inadequate or no protection. And then DC did not get treated like a state. It got treated like a territory when they figured out the state funding, and she wants to get it the increased amount it should have. So that is the big picture. There's an enormous amount in there. We're figuring out more every day. There's lots of money for particular programs like child welfare that are much smaller pots of money, and so I didn't put them in this list. But just because it's not in here doesn't necessarily mean it's not covered. In terms of populations, the population that really didn't get what it should have is the immigrants, many of whom are tax-paying, working, normally working people, but they're not getting covered, and that's just incredibly inequitable. Okay, I am now going to turn this over to David Cooper. Now that you know what's coming federally, David, can you talk about the economy?
Sure, Debbie. Thanks for introducing me, and thank you to the previous speakers, and thank you to all the guests that are watching this. My name is David Cooper. I'm a senior analyst at the Economic Policy Institute in Washington, D.C. As was mentioned, I'm also the deputy director of the Economic Analysis and Research Network, which is a network of state and local level policy organizations. Voices for Illinois Children is one of our members in Illinois. So I'm going to talk a little bit about what all this means for the broader economy. If you want to go to the next slide, Debbie, this is a version of the chart that Bill already showed. We actually made this version before the numbers officially came out. This was our prediction based upon news reports. But it's basically just showing that when you look at the number of folks who filed unemployment claims last week, it is unlike anything we have ever seen before in terms of the magnitude of claims. You can go ahead to the next slide, Debbie. And when we look at how the potential job losses compare right now to past recessions, so that first bar is the worst 5 months of the Great Depression. The country lost just under 5% of total employment. In the worst 5 months of the Great Recession, we lost just over 2%. of total employment. Our best prediction right now is that from February to June of this year, we will lose somewhere around 9% of total employment in the US. That's about 14 million workers. Now, that number's based on macroeconomic forecasting by some of the financial firms like Goldman Sachs and Morgan Stanley, who predicted a week ago that as a result of all the closures related to the coronavirus, they expect that GDP will contract by about 6% in the first quarter of this year and by about 24% in the second quarter of this year. When you take those losses in GDP and just translate them into jobs, it's about 14 million jobs. Now, those were estimates that were made a week ago, so they don't take into account the bill that was just passed, and I'll talk a little bit about how that might impact the numbers. Although they did account when they made those estimates, they were assuming that there would be a $1 trillion stimulus package that passed. The bill that is likely to be signed by the president today is a little over $2 trillion. Again, I can speculate a little bit as to how that will affect the numbers, but we'll stick with those estimates for right now because I think they're still helpful in understanding the magnitude of this shock on the economy. If you want to go to the next slide, Debbie. Basically, what we did is we took that 14 million lost jobs nationally and distributed it across the states. This is from a blog post that's up on our website to look at what the state level losses are likely to be. And in Illinois, we estimate that Illinois is likely to lose, this is again through June, about 550,000 jobs. This is about 10% of all jobs in Illinois. And a lot of this, the reason why in Illinois it's 10% as opposed to the 9.1 or 9.3, whatever it was we were projecting for the nation is because of that aspect that Bill talked about, the fact that sectors like retail, restaurants, leisure and hospitality, social service providers, because those jobs make up a larger share of Illinois employment than the country on average, the losses are probably going to be a little more concentrated in Illinois than they are in other places. And again, as I said, the 14 million job estimate is probably a little outdated at this point. The hope is that the package that is likely to be passed today will mitigate those numbers a bit. But the truth is, forecasters have been updating these numbers for weeks. And you know, I want to say, I think it was maybe 3 or 4 days before we released that 14 million job loss estimate. We were only projecting about a 5 million job estimate because the GDP losses that were anticipated weren't expected to be as great as the forecasters thought even a few days later. So this is a very highly evolving situation, and everyone's trying to get a grasp on what we think the likely impacts will be. You can go to the next slide, Debbie. So, this again is Bill showed a similar slide to this. This is looking at unemployment claims just in Illinois. And again, last week, the claims in Illinois were about 115,000, which is vastly larger than any of the weekly claims that have ever been experienced in the state before. Why don't you go ahead to the next slide, Debbie? Now that bar that you saw previously, just to sort of help show how dramatic this increase is relative to other periods, this chart is basically showing the same thing, but it's using a rolling 6-week average because not everyone files for unemployment in the same week. And so, if you capture kind of the average claims over a 6-week period, you can see that thin little bar at the far right is the claims from the most recent 6 weeks in Illinois. The only other time where there was ever a significant increase in unemployment like this is, you can see that period right around the beginning of 2009. That's the Great Recession. But again, even that is nothing compared to what we're seeing right now. So, all of these job losses and unemployment claims, if we were to try and think about what that means for the unemployment rate, it's sort of a tough question, because if Illinois, the 550,000 jobs lost, if you were to just take those people and add them on to the number of folks in Illinois who are currently unemployed, there's about 217,000 people in Illinois who, as of last month, were considered unemployed. It would raise the unemployment rate in Illinois up to about 12%. That would be higher than the unemployment rate has ever been in Illinois. The highest previously was 11.3%, which was in the Great Recession. Now, again, it's a little bit hard to know whether that's an accurate comparison, though, because to be unemployed in a statistical sense, you're only technically unemployed if you're looking for work, as Debbie mentioned earlier. So because right now we can't expect people to be looking for work, we want them to be at home, social distancing, not out, passing resumes around. It's hard to know whether you would quantify them as technically unemployed. It may be that the statisticians would consider those folks just out of the labor force. So it's not entirely clear how that's going to affect unemployment estimates, but I mean, the result is still the same. These are folks who are not working, who are not receiving a paycheck. The one thing that I would say, though, is that, at this point, unfortunately, that is what we want. We need folks to be staying home. We need them to not be working or seeking work because it's the best way to try and slow the spread of the virus. And in terms of what this means for, the recovery, the truth is, I don't think anyone really has a great sense of how long these conditions are going to persist. And so it's hard to predict how long or how deep this recession is going to be. In the best case scenario, if everyone were to strictly adhere to these social distancing measures, stay at home, testing were to expand dramatically, we would start to get a better handle on exactly where the virus was and quarantine those folks and slow down the spread of the virus. It's possible that because of the measures that are in this legislation that's moving in Congress, if we can get money to folks to stay home, if essentially the government can pay people to stay home and not work, the hope is that you can provide relief to them that carries them through this period of not working. And then once the social distancing measures can be lifted, then we would probably need to pass an additional stimulus to then jumpstart the economy, get it going again. I will say that because of all the increases in unemployment programs that Debbie talked about, the hope is that those programs will allow more folks to stay connected to the labor force, to stay connected to their current employers. Under typical circumstances, most people who are laid off, about 40% of them will return, when they return to work, will return to their original employer. The hope is that with measures like the ones that are being passed now, that more folks that are being temporarily laid off as businesses shutter are able to go back to their existing jobs as soon as the social distancing measures are lifted, and thus the recovery will be fairly, I won't say quick, but will be faster than like the recovery in the past recession. This is not a typical recession because this is something that, in some ways, it's a recession that we've had to do in order to stop the spread of this illness. So you can go ahead to the next slide, Debbie. I just want to show folks just some contact information. EPI has a lot of materials on the coronavirus and the required policy response to the coronavirus. EARN, the network that I talked about, there's a lot of materials being published by our partners that we're trying to aggregate on that site. And I'm always happy to take questions for folks. My contact information is there. I'll stop and pass the baton to whomever's next.
And next is David Merriman.
Hi, thanks a lot, and appreciate the chance to follow those two presentations, which were really great. You can go to the next slide, please. So in some ways, following up on what David was saying, we expect an impact on the national economy. It's probably not a surprise to anybody that everybody expects that there's going to be a large recession, certainly a huge decrease in economic output. This recession is a lot different than some other recessions we've seen. There's a recession on the supply shock, that is what we can produce as an economy. And that's kind of what we want. We want people to stay home. We want them to diminish their productive activities so that we deal with the public health threat. But we also worry about a demand shock. That is, as people have less money and also as people worry about their economic futures with asset prices falling and other things, that can also reduce output. And so we're going to have policy responses to both of those things. How big will the recession be? Well, you heard some estimates. There's tremendous uncertainty about the size of the supply shock and about what's going to happen with the demand shock, how people are going to respond to it. And that's largely because it's an unprecedented kind of situation, or at least unprecedented in recent memory, particularly with respect to the public health threat. So if we just go on to the next slide, please. So this is an estimate from Moody's. It's a very recent estimate, just within the last couple of days. It shows what the original expectation was for GDP growth and then what the forecast is for the future. So they think GDP in 2019 grew about 2.3%. And in 20, they're predicting a decrease of about 2% in GDP, and that's in total output. But then in 2021, kick back up to 2.3%. So most forecasters are predicting this relatively short shock. It's a pretty significant shock, but it should be short. Go on to the next slide, please. So this is a different model, and this is one that's specifically from some researchers in Australia that have specifically done a lot of work on pandemics and the effect of pandemics on the economy. And they have a bunch of different simulations here with different colors. I just want you to look at the sort of the most pessimistic one, which is the one that shows an 8% drop in GDP in the first year. And even with that, notice by the second year, we're back up almost to zero, which is really the baseline. We'd be back up to where GDP was before. And then by the third year, there's some hope that we'd be kind of above what we otherwise would have been. So there's hopefully going to be some pent-up demand. There's a bunch of different scenarios here. That's the most pessimistic one. So please go to the next slide. Okay, so what will this do for Illinois? And I very much appreciate David's numbers. I haven't seen those before about the impact in terms of employment. But my take is Illinois is a very diversified economy, and it looks a lot like the nation as a whole. So the impact on Illinois will probably be relatively similar to the rest of the country, maybe a little bit more intense for the reasons that David just talked about. Please go to the next slide. Okay, and so the thing that I've really been working on is what's the impact on government revenues, and particularly on kind of the government fiscal situation. And we know that recessions always hurt government revenues. We get less tax revenue because people become unemployed, less capital gains revenue because asset prices fall, and we often get less sales tax revenue. We think in terms of government revenues, this recession will be probably a lot worse than typical. It's going to be a lot worse than typical because we have, first of all, a huge drop in employment, although many of the people will be compensated to get some compensation because of the bills that Deborah talked about. But in particular, with sales tax revenue, we expect that to drop a lot just because we've shut down huge chunks of the retail sector. So let's look at the next two slides with data and some forecast. So this just shows you what's happened in past recessions in Illinois, and it's for the general funds, which is not all revenue in Illinois, but most of them. And you can see, and it's got it broken down by types of revenue. There's a lot, it's a kind of a busy slide, but you can see for the 2008 recession, you can see a pretty significant drop in revenues, and then we also see some drops in revenues when the tax rate changed. Next slide, please. We've used the estimates of the recession and how much the economy will contract in the recession, together with past information about how revenues responded to those recessionary periods. And we've tried to take into account what we expect to happen to the major revenues in Illinois. And this is just 3 of the revenue sources: the income tax, the sales tax, and the corporate income tax. And you can see the top line is what we would expect to happen to baseline revenues in the absence of a recession. Those revenue sources give us about $37 billion of revenue now, and we'd expect that to rise. And this is regardless of what happened. This is assuming there's no increase in the fair tax that Governor Pritzker is talking about. We'd expect revenues to rise about $43 billion. And we've looked at what the revenue losses will be from different scenarios. And so the most negative scenario, that one that I talked about before, shows this bottom blue line here. And I'm just going to pull up the numbers here. The loss in revenue, yeah, you can see the decline in revenues could be as much as 6% for each of the next 3 years. And so we could talk about a $6 billion loss in revenue. That could be an annual loss in revenue. You heard earlier from Deborah that Illinois might get $5 billion from the federal government, but that $5 billion would be split between the state and the local government. And so that would not be enough to make up for the lost revenue. Next slide, please. The other side of the budgetary equation for Illinois is on the spending side. Recessions generally raise government spending on safety net programs, and unemployment claims will surely go up in this recession as well, as they do in most recessions. Next slide, please. And Deborah talked a lot about what the federal aid is going to be. I want to go, and so I won't go over this, and she had a lot more detail than I have here. But if we just go to the next slide. So the enhanced Medicaid match will help some, although the enhanced Medicaid match in this recession is a 6% increase in the matching rate, which compares to an almost 12% increase in the matching rate in the 2008 recession. That will bring only if Medicaid revenues, Medicaid spending is about $5 billion more than we otherwise expected, it will only bring about an additional $310 million to Illinois. So the Medicaid match will help some, but it's not going to cover all of our increased Medicaid costs by any means. And as I said before, the coronavirus relief fund won't be enough to cover the decline in state revenues. So those are the major points. I mean, the idea that we're going to need, as Representative Pelosi says, that we're going to need additional bailouts for state governments seems very clearly to be the case in Illinois. That we're gonna certainly be hurt fiscally by this recession in a significant way. And I think that's the last I have one more slide. I think that's the last slide, basically. Yeah, that's my last slide.
Thank you. This is Mitch. I'll pick up from here. I know that 1:30 was our conclusion time, so I'll be brief. So some of the questions that are outstanding now are with respect to what is needed on the state level to implement some of the provisions of the federal relief package. The state officials will be parsing through this, but it's quite likely that not only would there need to be some changes in state statutes to implement the programs, but also there will be a need to amend the appropriation authority. So at the moment, both the House and the Senate have canceled session for next week. There was already on the calendar a 2-week break scheduled, but the House Democrats' chief of staff has indicated that legislators should expect the possibility of coming back during the break to act on some measures. And for measures that were already working their way through the legislature, the deadlines have been extended. We can go to the next slide, please. So as I mentioned, there are questions about amending the state budget for the current fiscal year, and then there is approving a budget for the next fiscal year. When the governor proposed his budget for the next fiscal year, he had just under $1.5 billion held in reserve, and that spending was dependent on the outcome of the question voters will face in November about a graduated income tax. Just to echo what David said a few minutes ago, the Commission on Government Forecasting and Accountability just recently came out with a 3-year budget projection, and you can see on that last line, if there were to be a decline of 20% in revenues, we could be seeing over a few years a reduction of $8 billion. So again, to the extent that the money from the federal government does not fill the hole, what decisions will members of the General Assembly make about meeting some of those needs? We go to the next slide. And Deb touched on some of this with respect to what might be in a fourth bill. These are just some of the areas, but the question would be, prior to passage of a fourth bill, or if there is not enough to meet the state's needs, what will the state do? Will the state look at revenue enhancement measures or shifting around its priorities to meet some of the more immediate needs? Next slide, please. I believe someone had their mic up, but I just want to let you know that these websites can provide resources to you. There is the state website, the YWCA's website has information about COVID-19 as well as community resources, as does the Voices for Illinois Children website. Tasha and Deb, if we want to take 1 or 2 questions, I know we're tight on time. We can proceed with that.
Yes, Deb, can we take one or two questions if that's okay? Bill has recorded all of the questions. If we can just at least get 1 or 2 out, that would be fantastic.
Yeah, so I'm going to say, first of all, that everyone should know that you will get the recording and the slides, and that we won't take questions about how you apply for these things because we don't know yet. And I'm looking at the Q&A questions to see if we can handle any of these here. But I can keep this line open until almost 3 o'clock, Tasha. So I do want to answer quickly. As far as I know, the immigrant provisions are pretty bad, but I will be sending the information on that to Mitch and Tasha. I do not think undocumented workers even get the $500 in the stimulus package. And not only that, if you've got one documented person with a social security number married to somebody with a I-10 and they file together, that whole family doesn't get it. The immigrants really did not get a good deal. Beyond that, Tasha, we can take any questions you would like to take.
Okay. Bill, are there any questions in there that we can answer at this moment? If we cannot answer these questions right now, we will post those answers on our website at www.voicesforkids.org. And you can also reach out to myself. My email is pictured there below, as well as Dr. Bill Burns and Mitch Lipson. But I do want to take a moment and thank all of you for joining this webinar. You do very, very important work. And I wish that we were not in this circumstance, but we're all in this together. Voices is here along with the YWCA Metropolitan Chicago to continue to be vigilant on this effort and to make sure that this relief package in Illinois, when it gets all signed and delivered, that we advocate to ensure that this gets done quickly, that this gets implemented very quickly. It's going to be important in terms of on how fast we can work to get this off the ground. We know that many folks need these resources. And so we will keep you abreast. We will keep our ears close to what's happening. Deb Stein is there in Washington, D.C. She does a fantastic job of keeping all of us updated on what's happening on the federal level. So with that, this concludes our webinar. Please, keep an eye out for a part 2. We will certainly have another one of these webinars. We want to keep you updated. We want to keep you doing the important work, and then let us do the advocacy work and try to push this forward. So thank you all, and appreciate your time today.